There will always be seams and interfaces between people, between services, between organisations. But I think what we have to do is pay attention to those seams, reinforce them, so that we educate people who are aware of the risks that interfaces present and who are conscious of the fact that you need to work at communicating and collaborating. And I think we really need to look at it at three levels. I mean, first of all, there's the level of the patient. We train people to meet the clinical needs and the social care needs of patients. What we don't do is train people very well to engage with people, to find out what people's priorities are, to take a coaching rather than a telling approach to those conversations, to make sure that we know what the patient's priorities are. And the second level would be, and this is really a culture change, would be encouraging people to think more about groups of populations, groups of patients, patient pathways, what care should look like in the main for the majority of people in terms of evidence-based interventions, collecting the metrics about the population you're dealing with, and using those metrics to review performance. And then there's a third level, which is the level at which organizations, provider organizations, work together. And I don't think integrated care needs or benefits particularly from merging organizations. I think it's much more about a willing collaboration so that people are working together for the benefit of patients and users and making sure that we don't have perverse incentives that make us duplicate or hold information or create silos.